The national anthem.
I am presenting these terms of reference, standing in for the Acting Permanent Secretary, Federal Ministry of Budget and Economic Planning, who would have been here, but for the extensive of work, he was not able to be here. I'll first of all want to congratulate you, Your Excellency, and all the distinguished council members of Rivers State on this inauguration of the State Council on Nutrition. So the terms of reference are here. The terms of reference, this terms of reference is structured to ensure clarity of rules, governance, accountability, and strategic guidance in line with the national priorities. Background. The Nutrition 774 initiative is a multi-sectoral community-based framework established to improve nutritional outcomes across Nigeria's 774 local government areas. The State Council on Nutrition is constituted to provide overall leadership, policy direction, coordination, and oversight for the effective implementation and sustainability of the nutrition activities in the state, in line with the policy directives, and in particular, to drive the implementation of the N774 initiative in Rivers State. The vision is to achieve a well-nourished and healthy Nigerian population through strengthened local systems and coordinated national actions on nutrition. The objectives of the Council are: 1, to provide strategic guidance and national policy direction for nutrition. 2 is to ensure high-level multi-sectoral coordination oversight among state and local government stakeholders. 3, to promote accountability mechanisms at all levels of the implementation. The 4th is to mobilize state and local government resources to support N774 initiative implementation. Whereas the 5th objective is to oversee the monitoring and evaluation for evidence-based decision-making and reporting. I will not bother to go over this slide again, since the members have already been inaugurated. So the roles and responsibilities, these include to provide strategic direction and policy by approving state priorities and targets for Nutrition 774 initiative, to align initiative objectives with national and state nutrition policies, health plans, and global goals, and to promote integration into government programming and budgeting process. Another role is for coordination and oversight, and this includes to provide intersectoral coordination to avoid duplication and ensure synergy, to facilitate collaboration between federal, state, and local levels, to monitor adherence to standard operating procedures, that's the SOP, and implementation guidelines. The next is resource mobilization and financing. And it is expected that this council advocates for increased domestic and external funding, guide public-private partnerships for program sustainability, monitor and ensure equitable resource allocation. The fourth responsibility and roles here includes the monitoring, evaluation, and accountability. The Council is expected to review program performance reports, recommend course corrections based on evidence and field realities, promote transparency, data use, and learning across sectors. So, meetings. The Council shall meet quarterly or as required at the instance of the chair. Emergency meetings may be called by the chairperson or at the request of at least 1/3 of the members. A quorum shall consist of at least 50% of members, including the chair or designated representative. Secretariat support. The State Committee on Food and Nutrition at the State Ministry of Budget and National Planning shall serve as the secretariat responsible for providing and coordinating logistics, technical, and administrative support to the State Council on Nutrition. Tenure. The Council shall exist as long as the nutrition policy exists. That's the food and nutrition policy. Supporting the nutrition policy direction of the federal government of Nigeria in implementing the N774 initiative with periodic reviews every 2 years to assess membership effectiveness and relevance. Reporting. The Council shall submit progress reports to National Council on Nutrition annually through the Permanent Secretary of the Federal Ministry of Budget and Economic Planning. Thank you very much, Your Excellency.
Your Excellency, let me first thank you for your swift response to our letters from the Office of the Vice President, which has made today's meeting possible, and also for the warm reception accorded to my team and I, which goes a long way to say good things about your administration and, of course, the good people of Rivers State. Your Excellency, we are here in your beautiful state of Rivers because of an initiative very, very dear to the President and Commander-in-Chief of the Armed Forces, President Bola Ahmed Tinubu, GCFR. This initiative, the Nutrition 774, which Council is chaired by His Excellency, the Vice President of the Federal Republic of Nigeria, Senator Kashim Shettima, GCON, on whose instance and directives we are here today, because of the importance the federal government of Nigeria attaches to it. Nutrition 774, chaired by the Vice President and coordinated by the Ministry of Budget and Economic Planning, in collaboration with various ministries cross-cutting to health, agriculture, industry, trade and investment, and so many more MDAs. It's a unique structure that also brings in the legislature, the Nigerian Governors Forum, the Association of Local Government of Nigeria, and enjoys strong support from development partners such as UNICEF, Nutrition International, the World Bank, African Development Bank, Helen Keller, GAIN, civil society organizations, and of course the Nutrition Society of Nigeria. The Nutrition 774 is in fact, Your Excellency, a bold response to the silent crisis of malnutrition across our 36 states plus one and 774 local government areas. One is to inaugurate the State Council, which you will be doing today. Thank you, Your Excellency. The second is to designate a focal person within the office of the administrator that will provide technical guidance and also to help with the implementation of the N774. This would help with seamless coordination with the Office of the Vice President, while the State Ministry of Budget and Economic Planning works with the Federal Ministry of Budget and Economic Planning for coordination. Number 3, Your Excellency, is to select pioneer states working with the ALGON, where we would start up this N774 initiative. Following this is like I had mentioned earlier, based on the scorecards, and before this meeting we had an engagement with the permanent secretary, I believe, to be able to highlight what these challenges are, because we want this tailored to the needs of Rivers. We're not coming from Abuja to tell Rivers State what to do. We want Rivers State to take this as their own and make sure it fits their own challenges. So to designate the establishment and direct the establishment of nutrition departments in the relevant MDAs, and then also implementation of the 6 months paid maternity leave. Recently, after a visit with Abia State, we've seen that they've also implemented theirs, their 6-week maternity leaves. Again, this is to help our mothers breastfeed the children so they get the right nutrients. The other bit is to increase the number of imam sites, which I mentioned, for inpatient and outpatient care to cater for children with moderate and severe acute malnutrition. Number 5 is the timely release of the Child Nutrition Fund. So the UNICEF, in partnership with Bill and Melinda Gates, they have the Child Nutrition Fund where they do a 1-to-1. For every $1 that is released by the government, they release an equivalent of $1. So it's really as though it's buy one, get one free. So it's something that we can leverage on as a country, and particularly for Rivers State. To establish nutrition excellence centers, this will ensure implementation of nutrition interventions across the 5 pillars that was mentioned earlier, the 5 sectors. And usually it will be the PHCs to select particular PHCs that will be used as the nutrition excellence centers. With this, Your Excellency, and given your experience as having served as the Chief of Naval Staff, I know that with you as commanding officer and Major General, we can fight this war against malnutrition effectively. And I do hope that with these few points of mine, I've been able to convince you and not confuse you that nutrition is worth investing in for the good of our country, Nigeria. Thank you, and God bless.
Thank you very much. Mr. Sidi, taking into cognizance the fact that His Excellency is chairman of the committee.
Representing His Excellency the Vice President of the Federal Republic of Nigeria, and with your kind permission, Your Excellency the sole administrator of Rivers, I would like to inaugurate the State Council on Nutrition in Rivers State. This includes Your Excellency the Vice Admiral and the sole administrator of Rivers State, who will serve as the chairman of the State Council on Nutrition, the Permanent Secretary, Budget and Economic Planning, who will serve as the vice chairman, the state focal person for the N774, who will serve as the secretary in the name of Professor Chitru, the acting permanent secretary health, the permanent secretary agriculture, the permanent secretary education, permanent secretary finance, permanent secretary women affairs, permanent secretary information and communication, permanent secretary water resources, and the ALGON chairman. These most distinguished members, haven't listed, will serve as members of the State Council on Nutrition, Rivers State, and of course with His Excellency the Vice Admiral Retired Ibok Ibas, CFR, the sole administrator of Rivers State, will serve as its chairman. Having said this, You are now all inaugurated as the State Council on Nutrition, Rivers State. Thank you.
Thank you very much.
Honorable Dr. Samuel Kalabo, the Administrator of Port Harcourt Local Government Area and the Chairman of Algon in Rivers State. Distinguished invited guests, gentlemen of the press, ladies and gentlemen, it is with great honor and deep sense of responsibility that I welcome the advocacy team for the Nutrition 774 initiative from the Office of the Vice President of the Federal Republic of Nigeria, ably led by Mrs. Uju Rochas-Anwukah to Rivers State. I want to commend Mrs. Anwukah and also thank her for the detailed and elaborate brief on the N774 initiative, and also for inaugurating the State Council on behalf of the Chairman of the Council. I want you to extend our warm felicitation as you go back to His Excellency Alhaji Kashim Shettima, GCON, Vice President of the Federal Republic of Nigeria and the Chairman of the National Council on Nutrition. And so today, as I speak, not only as Administrator of Rivers State, but also in my newly inaugurated role as the Chairman of the Rivers State Council on Nutrition, a position that underscores my commitment to ensuring health and nutritional well-being of every citizen in Rivers State. The Nutrition 774 initiative is not just another program. It is a transformational intervention. For the first time, we have a government-led, community-driven, multi-sectoral framework that brings all efforts under one coordinated umbrella. It is designed to replace duplication with coordination, uncertainty with clarity, and scattered efforts with measurable, unified results. And I think we're able to see the Rivers State scorecard. N774 is also a critical tool for achieving multiple sustainable development goals. By investing in nutrition, we invest in education, productivity, economic growth, and stability. Its 5 pillars, as clearly highlighted, which include decentralized coordination, data accountability, sustainable financing, nutrition prioritization, and scaling interventions, are the foundations of its success, as they collectively empower subnational and local government areas to lead locally tailored interventions, build robust systems to track and measure progress, ensure sustainable resources at state and local levels, elevate nutrition to a central place in our policy agenda, and expand effective programs to reach every community. Rivers State is fully committed to the success of this initiative. We have demonstrated this commitment by allocating 10.8 of our 2025 state budget to the health sector, a direct investment in our people's future. But our commitment is not just financial. It is strategic and action-driven. This administration has approved the establishment of dedicated nutrition departments and the creation of a nutrition budget line in all line ministries. This ensures that nutrition is mainstreamed across sectors and given the financial priority it deserves. We are strengthening healthcare delivery through public-private partnerships with reputable firms and institutions to manage and operate key health facilities, including the Mother and Child Hospital and the Dr. Peter Odili Cancer and Cardiovascular Diagnostic Center. These partnerships are designed to ensure world-class service delivery, improve access to specialized care, and guarantee sustainability. In agriculture, which directly underpins nutrition, we are revitalizing the Songa integrated farms to boost local food production, scale up the River State cassava processing plant to improve food supply chains and value addition, and pursuing other agro-industrial initiatives aimed at ensuring food security, reducing dependency on imports, and empowering local farmers. All these interventions, institutional strengthening, healthcare reforms, agricultural revitalization, and community-level engagement are fully aligned with the N774 initiatives. They reflect our holistic understanding that nutrition security is built on strong health systems, resilient food systems, as well as targeted community interventions. We recognize that malnutrition and nutrition-related disease, whether undernutrition, overnutrition, or micronutrient deficiencies, are silent killers and major barriers to human development. And so we cannot build a prosperous state on empty stomachs. I therefore call on all stakeholders, the local government councils represented by their chairman here, traditional rulers, civil society organizations, the private sector, and development partners to align all programs with the Nutrition 774 framework. We do not need to work in silos here. The fight against malnutrition must be unified, coordinated, and relentless. The enemy is not one another, the enemy is malnutrition, and it must be defeated. And for members of the newly inaugurated Rivers State Council on Nutrition, we have been entrusted with a sacred and urgent responsibility. This is not a ceremonial appointment. It is a mandate to save lives, protect futures, and strengthen the foundations of our state. I therefore charge members to lead with urgency and recognize that malnutrition as a public health and human capital emergency. I also urge members to coordinate our actions without rivalry and to harmonize all interventions across ministries, local government areas, partners, and communities into a single result-driven plan. We must rely on data. We must let evidence, not guesswork, guide every of our decision. And we must mobilize partners and engage leaders at every level to pool resources and expertise. Finally, I think we must deliver measurable results that can be judged, not judged by meetings, number of meetings held, but by the lives saved and communities transformed. I want to believe that by 2026, when the scorecards, when the results of all the states are compiled, we will see something different from what we have just been presented here. We must therefore align every action with the N774 initiative and our state's broader health and development agenda. And we must remember that our work will be measured in healthier children, stronger mothers, and more productive communities. And so I charge us all to go forth with focus, discipline, and compassion to make Rivers State a model for the nation. In conclusion, I want to say that in Rivers State, we will not allow malnutrition to steal our future. We will drive this initiative with seriousness, transparency, and sustained commitment. When our children are nourished, our schools will excel. When our mothers are healthy, our communities will prosper. When our people are strong, our state will be unshakable. Let us work together to ensure that nutrition is not just about food. It is about the future we choose to build. Thank you. God bless Rivers State, and God bless Federal Republic.